Hi, I'm Dr. Henry Black, Clinical Professor of Internal Medicine at the New York University School of Medicine and President of the American Society of Hypertension. And I'm here today with Dr. Sonia Angell, who's Director of Cardiovascular Disease Prevention and Control for the City Department of Health in New York City. We've been talking a little bit about what New York City's done to lead the way in changing the environment to try to prevent heart disease. And I'd like Sonia to show us some of the specific programs.
Sure. So maybe I'll talk first about some of the work we're doing around controlling hypertension. Most of our programming has been developed focusing either on high-risk populations in the clinical environment or in the community environment with respect to hypertension control. So one of the things that we've produced is a public health detailing campaign. This is the packet, this is the kit as an example here, that we conducted working through development with one of our other programs, the Clinical Systems Improvement Program. The public health detailing campaign sends public health workers along the same model as the pharmaceutical model into clinics in some of our highest risk communities and using materials that are in here that are developed both for providers and for patients.
So you're doing detailing, really?
They're doing detailing. That's
Right.
exactly what they're doing. They visit the providers twice for any specific campaign, and they reached over 1,500 providers over a 3-month period, and that reached over 95% of all ambulatory outpatient clinics within 3 of New York City's highest risk neighborhoods. Those are areas with very high rates of hypertension.
Are there providers interested?
Absolutely. In fact, the public health detailers, when they go into the offices, actually get more time with the providers, certainly, than pharmaceutical reps do.
Yeah.
They've developed a very strong relationship with the providers as they go in time after
Well,
time.
I've always thought that all providers, doctors for sure, and others, have a real pride in how they work, not the way sometimes we are sometimes perceived. So if somebody comes and gives us good information, we'll use it, and we'll use it to advantage.
Right.
How about patients? Do patients like this sort of approach?
Well, right. So the campaign itself brings with it a lot of materials that can be used in the waiting rooms for patients as well as tools that they can use to help control their blood pressure. So for instance, we developed these tracking cards that are available in multiple languages. I just have them in Spanish and in English and in different sizes here. These are for putting into your wallet if you're the wallet kind of carrier. But certainly this is a tool that we know helps enhance patient control and management of disease, self-blood pressure monitoring.
How is this supported?
It's supported by the New York City Department of Health, and it's supported by and large by city tax levy dollars.
So I would imagine that the city's wise enough and the commissioner's wise enough to realize that if we can reduce complications, morbidity, and mortality from the most common cause of death and morbidity in the city, that's going to help us out in the long run.
That's right. Hypertension is a major public health priority in New York City, as it is certainly across the nation, and identified as such.
I mean, one of the things we always argue with when we're trying to do cost effectiveness things about blood pressure, say, or about heart disease prevention, we have a hard job proving that we're really saving money. We're reducing morbidity. We're making people's quality of life better. But I think, as a famous epidemiologist said, the cheapest patient is the dead patient.
Oh dear.
And this is not the way that we as healthcare professionals, and especially with the kind of influence that you would have in the Department of Health, we can't cotton to that idea.
Absolutely.
We have to say, maybe we can't prove we're saving money, but we know we'd rather not have a stroke.
That's right.
And not have a heart attack.
And our mission at the Department of Health is to improve health. It's absolutely first and foremost.
Thanks very much, Sonia. That was great.
My pleasure.